What is a cold, low-level laser? What kind of treatment is that?
Uh, well, first let me start with what is a laser. The
All
acronym
right.
laser is light amplification by stimulated emission radiation.
Say
Um,
that again.
light amplification,
Mm-hmm.
amplifying light, by stimulated emission of radiation.
Okay.
And so there are two different types of lasers used in treatment.
Mm-hmm.
One is the cold low-level laser, which you mentioned, and the other type would be a more high-power laser, which is used for surgeries and cutting and things
Mm-hmm.
like that. So the cold low-level laser is called cold because it doesn't heat. You don't really, when you apply the laser probe, you don't really feel it a whole lot.
Mm-hmm.
Now, the power outputs of laser vary. So some lasers you can feel heat and some you can't. But the idea of the cold low-level laser is not to cut or burn,
Mm-hmm.
but is to stimulate the cellular healing response. And so it is applied to an area. It's whatever area you want to treat. It's used to treat itises, so inflammation of whatever. So sinusitis, you'd apply it to the maxillary sinuses and the frontal sinuses,
All right.
and it lowers the inflammation that is occurring there. Arthritis, so you got achy joints, and this is probably one of the most common things I use it for. You apply the laser right on the achy joints, and it lowers the pain and inflammation in those areas. Carpal tunnel is another common one I see, because it tends to have an effect to, again, lower the inflammation surrounding the nerve. And but the effects of laser are such that it can be used for a lot of things. It's not a magic wand. It's not a cure-all.
Mm-hmm. Okay.
But because of the mechanisms by which it works, mainly to decrease inflammation, pain, and stimulate the local immune system, stimulate microcirculation or circulation in that area, it tends to have a healing effect on a lot of different things. So, for instance, skin conditions.
I was going to ask about that, the skin.
A great indication for laser, because there's not many other good treatments for this, is a diabetic foot ulcer. Diabetes patients, they start to not be able to feel the pain in their feet, so they start to get ulcers. And I'd also probably give alpha-lipoic acid because it helps with peripheral neuropathy. But the laser is a good adjunctive tool because if you go around the edges of the wound, it stimulates the healing response of that skin so that the wound clears up. And we have a few really good cases of this with people who were fearing that they wouldn't be able to stand or walk around soon because they just kept developing these ulcers. And with treatment, they have gotten better. Now, what I've noticed is it takes more frequent treatments to really affect it. I've tried, spacing treatments out quite a bit and doing them more frequently, and it works a lot better more frequently. But yeah, so things like skin, even acne, eczema, psoriasis, these rashes can be helped because the laser is stimulating that healing response.
What about fibromyalgia with the muscles?
Yeah, fibromyalgia is interesting. Because one of the mechanisms by which the laser works is if you think about the biochemistry involved in the mitochondria, which is what produces energy in our body, there's a particular process by which the cells produce energy. And that process depends on a series of events, and they're called redox reactions. That involves reduction and oxidation. So they're basically like lifting a book off the ground. You're giving it potential energy, and then whenever you want to drop it, the energy is spent. Well, our body does the same thing by producing ATP. ATP is like the potential energy, and then our body can use it whenever it wants. And when you put laser light on an area, it actually puts energy into the system so that the creation of ATP is more optimal, and so you actually create more ATP, you have more potential energy, and when you do that, you have more energy available to help muscles relax. And in patients with fibromyalgia, they have tight muscles. They have these trigger points, so laser can help trigger points. But fibromyalgia patients also have sometimes a poor ability to produce ATP, and so it's kind of addressing two different things there. So yeah, it can be helpful for fibromyalgia. Most helpful for arthritis, carpal tunnel syndrome, sinusitis, anything with pain and inflammation. But yeah, fibromyalgia can get good responses as well.
So you've had some real success with many conditions.
Yeah, it's a tool I use a lot. It's not usually something I use exclusively by itself. I'm usually doing diet, lifestyle changes, herbs, nutrition, etc. But it's a good adjunctive tool that helps relieve pain, but also helps the underlying cause by assisting
Okay.
the body in naturally healing that area. So it's a tool I use a lot, and I'm very excited about. It's been around for about 30 years. There's over 2,500 studies done using laser, and at least 100 of those are good quality, double-blind, placebo-controlled trials for various conditions, positive trials. And most of the negative trials have been people not knowing what they're doing, not knowing how to use it, using the wrong dose, etc. But if you know what you're doing, if you get the right dose, the right wavelength of laser light, it can really have a positive effect. Now, people often ask me, well, how is laser different than a regular light? I mean, can't I just shine light on it? And part of it has to do with, for one, when you look at studies, they've compared both, and the laser just seems to work better. But two, the difference is in penetration depth. The laser is able to penetrate much deeper than a regular, say, LED, which is a light-emitting diode, a regular light bulb or anything like that. And it has to do with the mechanisms by which the laser is absorbed and how it interacts with the tissues. But it's able to penetrate much deeper and affect tissues deeper down, and all the research seems to indicate that it works better than an LED.
And one final question. If I get lasered, is it going to hurt?
No, if your practitioner is qualified, if they know what they're doing, if they're use the right parameters, you shouldn't hardly feel a thing. There are very few side effects to laser. Occasionally, some people get an initial pain response, and that's usually a positive thing, because what it's doing is it's accelerating the healing process in the cells. So sometimes you have to go through a little inflammation to get better. But they're really, other than that, and that's temporary, there is no side effects. It doesn't hurt. It's safe. It's effective. And there's very few contraindications. But, I would caution that a lot of people don't have adequate laser equipment, or they haven't been adequately trained in using it properly. So sometimes I've come across people who say, it didn't work for me, but I'm able to still get responses in those people, and it just might have been they didn't get the right dose or had good equipment.
Thank you, Dr. Ferguson.
Thank you.